Okay, so very good morning. It is good to see that at least the number is double, or maybe I can say triple, but still that this is not the full strength. Okay, so what we are going to discuss today is, am I audible? Audible till the last. Okay, so what we are going to discuss today is I told in the last class that pediatrics is primarily the growth and development. Whenever we talk about the pediatrics or the child health, we always think about the growth and the development. These are the two domains primarily taken care by the pediatrician. So what we are going to discuss is about this growth. Okay, so in the next 30 to 40 minutes, we are going to discuss about some principles about the growth, the normal pattern of growth, and how to monitor and how to see that the growth is going in a right direction or not going in the right direction by monitoring with the growth charts. So there are growth charts available. So on the basis of those growth charts, we will decide that where we are going. So what is growth? So in simple terms, we can say this is the essential continuous process that starts from conception to the mature adults with an increase in size and mass. So in a simple terms, we can say the growth is increase in size and mass. So it is a quantitative. That means we can measure. We can measure the growth. We can measure the size. We can measure the mass. Okay. So what is the development? So then development is a qualitative term. So development is actually the acquisition of skills in all aspects. So growth happen up to a certain extent. After that, only the weight that can increase at till whatever limit you want. But otherwise, when we talk about the growth, we usually talk about the linear growth or skeletal growth or lymphoid growth or the brain growth. So there is always a time till the time they will usually work, and after that there is an acquisition of skill. So this is the primary difference between the growth and development. So this is very important to understand sometimes even, and these are the short notes that usually comes in the even in the exams also. What is the difference between the growth and the development? Okay, so why it is really important to monitor the growth? All of us know that any child who is growing well, that means his child is healthy and a well-being of the child is very good. So we can say child is growing well, it's okay. At the same time, we can say this child is normal or this child is not normal. So it will identify the pathological factors early. So the first thing that got affected in pediatric population or in any population, if I am sick, what is the first thing I will do? Stop. I will reduce my activity and I stop eating. That is the first thing, whatever you don't like to eat. And the moment you stop eating, it affects your growth. But probably it is not affecting the adult life. But in a pediatric population, if the child is not eating well for a certain amount of time, it is definitely going to affect the growth. So that is very important. And so you can assess the pathological factors as early as possible. So we can say there are some principles. These are the principles. So this slide itself again a short note where we can talk about okay, so it's a sequential and orderly process. So there is a sequence of growth. It doesn't jump with the sequence, and this is an orderly process and predictable. We know that what is going to happen when the height will increase, when the weight will increase, how much the weight will increase, which part of the body will increase first. So this is actually a sequential and orderly process that you can see, and the growth usually start from the cephalocaudal direction. That means your growth initially start from the head and then go towards the lower side. So cephalocaudal direction and proximal distal segment. So your proximal segment will grow first and then there will be a growth of the distal segment. Both of them grow simultaneously, but the speed or the changes whatever you are able to see, that you are able to see in this particular part. So head to toe and axial function before extremities. I usually tell in my clinical classes what my teacher used to tell me, that pediatric is a wonderful branch in one way, that it is the branch when you can put your hand on the child's head, so you can bless that particular child because you are the bigger person, so elder person, so you can just bless the child, and when you are leaving the child you touch the foot because he taught you so many things in just in a simple from head to toe. So you start from the head by just touching the head and you go from the toe. So in that way you are able to find out the minute thing, the simple polydactyly. If you will not see the toe, then probably you will miss the polydactyly, and after a certain time extent, even it is very difficult to find out the polydactyly in Hrithik Roshan and Kaho Na Pyar Hai. है ना. The first film, everybody is surprised that is it really a polydactyly, but he had polydactyly. So it's very important. It's why it is important in pediatric population. In pediatric population, it is important because this polydactyly can be a indicator for something not good in the body. So this is abnormal behavior. Okay. So again, there is a dictum that if there is something outside, that means there is an indication something inside can also be there. So in pediatric population, if you find out anything that is not usually there, simply skin tag, just an ear tag. Ear tag is strong association has with the renal anomalies. So if a person is child is having an ear tag at the time of birth, I can start thinking about and I will advise abdominal USG, because there is a possibility. How can I see the kidney on an apparent eyes? Naked eyes you can't see, but when you are seeing an ear tag, you can start thinking, is there a possibility this child is having an renal anomaly, and you can advise the ultrasound. It may be normal, so it is not 100% that every child who is having an ear tag there is always a possibility that there is an uh, renal anomaly, but it gives you a hint. So that is very important. Growth is cyclical, it is not a constant. Many of the time the mothers comes to us in my OPD and they will say, first 6 months my baby is growing well, now is not growing. So we will see why that child is not growing, because this is a cyclical growth. You cannot grow with the same speed throughout your life. Otherwise your height and weight will go exponentially at I don't know which place. So it's very important that is cyclical and rate of growth is not constant. So this is the another principle that you need to remember, that depend on nutrition, that depend on environmental factors, so many things. So there are phases of rapid growth followed by slow growth. So rapid growth usually occur in first 1 year, and then second at the time of adolescent. So that is the second time when usually the growth start. So this period of rapid growth is called the critical period and most vulnerable to insult. So the first 2 years or first 5 years is very important in any pediatric, in any child's life. So if the this what we are seeing in the ward, there are a lot of children with the severe acute malnutrition because they didn't shift it to the complementary feeding at the right time, or even if they are shifting to a complementary feeding, they are not giving the correct complementary feeding at the right time. So these are the few phases. And during the adolescent, I think adolescent is the another phase when probably all of you gone through the adolescent phase now, na? So now you are so it's very important at that particular point. We are really not worried about the food. Most of the young adolescent or most of the young adults, yeah, well, yeah, sure. Okay, so where we are, adolescent. So now adolescent don't listen to anyone. So I know that I told last time also. Now I am having two kids. It's very difficult. Yesterday I told them that whatever you want from outside, they immediately jump to pizza. Otherwise, they will not take whatever the mother is preparing. So there is always an chaos. So it's very important that these are the critical period that is very important. You need to take care in that particular critical period. And growth pattern of every individual is unique and not similar in all children. And this is the reason why all of us are sitting with a different height, different weight, different structure, different facial features. So this is again a principle of growth. Growth is measurable both in terms of velocity and distance. So these are the few principles. This is given in the books as in tabular form only, so there is no need to write, but you can remember that there is a principle for growth. It is just not like that is an autonomous process and automatically things are growing. So there is a principle that you need to follow. So these are the four growth patterns. That is very important. Whatever you are here, that is because your brain is grown up well in first 2 years. So if you see, there are four types of growth. Uh, the growth is, we usually say there is a general growth, there is a brain and head growth, then there is a genitalia, and there is a lymphoid tissue. If you see the general growth, that what we usually call is a somatic growth. So what somatic growth usually do? If you see this somatic growth, the first 5 years, this is 2 years, 4 years, 6 years. So there is a first 4 years, there is an increase in growth, and there is an static phase. So this is sigmoid curve. So there is an static phase, and the moment you will reach to the 10 to 12 years, again there is a growth spurt. So this is the way they usually, and most of the children, they usually don't grow in that particular period of time. Their growth is little slower side on that particular point of time. So this is somatic growth. What about the brain and head growth? Brain, if you will see, then the brain growth usually start at the time of birth and reaches to the almost the peak by the age of 2.5 years to 4 years, and by 5 to 6 years the brain and head growth usually became static. So whatever is your head size you achieved at the age of 5 to 6 years. After 5 to 6 years, there is no growth in the brain in terms of size. You can still acquire the skills, but definitely the size is not going to grow after that. Then if you will see the lymphoid tissue, then lymphoid tissue is the first protective response in any human being in the early, especially in the early phase. So in early phase, this lymphoid tissue up to the age of 12 years they usually grow, and after the 12 years they start getting atrophied, and by the age of 18 to 20 years most of the thing usually get atrophied. And what you are seeing in genitalia, there is a slight growth in first 2 years, and then it will become static, and the moment you hit the puberty, again there is an genitalia growth is there. So it's very important to remember this particular growth curve. This is called Shamon's growth curve. This is the complete principle. Why it is important to understand? Because when you are monitoring or you are listening the mother's query, you know that what is the pattern of somatic growth. So if that is particular point of time child is not growing well, you can say this is a normal period. If a child is not growing well in the first 2 to 3 years or at the time of puberty, there may be something is wrong. So you start thinking there is something wrong, it is not correct. Similarly with the lymphoid tissue, you heard many of the times, maybe few of them had a recurrent episodes of tonsillitis or tonsillopharyngitis in the earlier age group, and your parents used to take you to a doctor every time that इसको तो tonsil हो जाते हैं बार बार. And if you take it out as a general pediatrician or a general physician, I am not aware of that what is the normal pattern of lymphoid growth. The moment you put the torch, you will see there is a large tonsillar uh, glands in the oral cavity, and you advise the tonsillectomy, because mother's complaint is there every time he develops the tonsillitis. You put it the torch and you see there is a large tonsils, and you can advise the tonsillectomy, but it is not right. There may be physiological increase. If you take it out, probably your immune response will go down. So many of the time there is a possibility, if they will go to the general pediatrician or not a very good ENT person, the ENT person immediately advise, because that is their bread and butter, tonsillectomy. So they immediately advise that you go ahead with the tonsillectomy at the age of 7 years, 8 years, 9 years. But you know that after the age of 12 years, this will automatically go down and the child's episode will further come down. Till that time, you can just avoid the triggering factors. Triggering factor means you are eating a lot of ice cream, spicy foods. Those are the things that can be avoided, and you can just continue with that. Definitely it is required tonsillectomy even at that point of time, but not in each and every child. Okay. Similarly with the brain, we already talked about. So this is the most important. Why I am saying the somatic growth is rapid in this particular period of time. So in fetal period, it starts from 0, and the time of birth, normally the mean length is 50 centimeter. So the 50 centimeters, so you grow maximum in utero. So you start from the 0 and you reaches to the 50. That means the growth rate, if you calculate, then it is almost 100 centimeter per year, because we are taking is a 9 months. So 9 months, 7 days, that means there is an 100 centimeter per year. So this is the growth velocity in utero. And once the child is born during the infancy, that is the first 2 years. What is the infant period? Last time we talked about 0 to, when we will say neonate, when we will say infant. 0 to 28 days is the neonate, and till the age of 1 year is infant. But infancy here we are considering till the age of 2 years in this particular slide. So the usually the in first year the length usually grows by 25 centimeter. So it child born with 50 centimeter, and at the age of 1 year the expected length is 75 centimeter. So how much it grown? It is grown is 25 centimeter. That means the growth velocity is cut down in 1 year from 50 centimeters to 25 centimeters. So it is almost half at that point, but it's still very high. In the second year, you usually get 12.5 centimeter. So 50 centimeter at birth, 1 year it is 75 centimeter, 2 year usually it is the 87.5 centimeter. So this is the usually we predict in a normal child, and then this growth become slowed down very significantly, and the growth is every year is 5 to 6 centimeter per year only. So if a child is growing 5 to 6, Any child who is growing less than 4 centimeter per year, it is pathological. Still, this is physiological. So we should know what is the cutoff. So 5 to 6 centimeter, and then again at the time of puberty, there is a spurt. The growth starts as a 8 to 12 centimeter per year is the normal growth velocity at the time of puberty. So and that will take you the final height. Okay. In fetal period, what are the factors that usually affect the growth is primarily the environment. Environment means the maternal environment. So that means the placental, maternal, and these are the things that is usually affect, and the insulin and the IGF-1. So these are the factors. Whenever there is a MCQ come in exams, which is the factor that affects most commonly, and as a if you didn't rate properly, we usually label it as a growth hormone, because we always think growth hormone is equal to growth, but it is not only growth is only affected by the growth hormone. There are many factors that usually work. So in antenatal period, environment, insulin, and IGF-1, these are the few things that is there. And then in second year, the nutrition is very important. Nowadays you are hearing many places first 1000 days. This first 1000 days include the mother's nutrition. That means the child, when the child is conceived till the age of 2 years. So 365 plus 365 plus 9 months 6 days. So those first 1000 days are the reason why you are at this point of sitting in a different phase. There may be one is lean and thin, someone is very obese. So this thing usually there. Then nutrition plays a very important role. In hormone, there is a thyroxine that usually start at the time, and thyroxine will remain throughout the period of growth. And then growth hormone usually start contributing its role by the age of 4 years. So most of the time, whenever there is a growth hormone deficiency, those children are not short in first to 4 years. After the age of 4 years, they stop growing, because then the role of growth hormone comes. So then they stop growing, and then they remain short, and then we need to investigate. And at the time of puberty, there is a role of sex hormone, that means testosterone and estradiol. They start giving that role. So what are the factors which can affect the growth? All of us know there is a genetic factor that is definitely there. So the mother parent height, mother parents resemblance is usually play a role. Race is another thing, from which part of the world you are belonging. Then male female, there is a difference. Then there is a chromosomal abnormalities, or if there is a chromosomal variation, that can also affect the growth. Hormone, I already talked about three important hormone that plays a very important role: thyroxine, growth hormone, and insulin. Then environmental factors, if the child is getting repeated infections due to whatever reason, there may be immunodeficiency, or this can be just a poor hygienic scenarios. And trauma to the growing bone. So if the child is developed rickets, that means the nutrition is not that good. So those children usually develop the growing bones. And any chronic systemic illness. So those are the children that usually got affected growth. Then emotional factor. Nowadays, this is another important factor that is affecting the growth even in the pediatric population. Okay, so now the child is having the stress from the time of he started going to the school. So now I think the most free period is first 2 years only, first 2 3 years. The moment your parents put you in the nursery, that means the mother start expecting that the day you come back first day from the nursery, you know the first rhyme what you learn in the school. So that is the one type of stress. Then there is the social factors, socio-economic class, education, academics, and all these things usually definitely going to affect the growth. So this is you already knowing from your clinical classes. It's just a revision what we are going to talk about in this particular class. These are the few anthropometric parameters that will give you what is growth. So we usually talk about the weight. We usually talk about the length or the height. I told you weight is considered up to a certain age as a parameter. After that, weight is not considered as a parameter for the growth, because and because it depends on your BMR. If your BMR is good, even if you are eating a good amount of nutrition, you always remain lean and thin. If your BMR is not good, whatever will do, whatever exercise you will do, you are going to be a little obese on that particular point of time. So that genetic factors play an important role. So, but the length of the height is very important. This is the most important criteria to say that you are really growing well. Then the head circumference, chest circumference, mid upper arm circumference. I think all of you know how to take it and what importance this is having. Upper segment, lower segment ratio, that is also important anthropometric parameter. Body mass index in children with the obesity, and growth velocity. So these are the few parameters in terms of pediatric population. In each and every child you need to monitor. So most of the time, whenever I'm not very sure, but if anybody's parents are doctor or pediatrician, I just want that is there in their clinic, if they are using the growth chart. They are not using the growth chart very regularly because you need time, you need to plot it, you need to calculate it. So most of the pediatrician and the parents come and they will say this is the problem. So they say they're not growing well. He will just write down a multivitamin supplement and calcium and advise some good nutrition diet and send him home. He will come back again after 1 year. The child is still not growing well. He will just change the brand name and again put it in some other multivitamin and some other calcium supplement, and maybe he will give Protein X and Cerelac, whatever the trade available in the market or more popular on the television. They usually advise them and then again send them back. But they are not having the growth velocity chart. So if they are having a growth velocity chart available, they can say there is something is wrong in this child. The child will not come back later on with some chronic systemic illness or simply a thalassemia minor or simply any other disease, sickle cell disease. So these are the things that usually got missed. So when to monitor? So obviously in each and every visit, especially institute like a busy institute, it is not possible for every child to and especially in the winter to take out the clothes and do the weight. Most of the parents will not agree, even the childs. So these are the parameters. So this is the vaccination age. If you can remember the vaccination schedule from your clinical classes, at the time of birth which vaccine we need to give? BCG and BCG, OPV and hepatitis B. Okay, so these are the 3 doses. So at the time of birth, you need to check the weight, length, head circumference, and penile length. This is must. So anybody in your vicinity is born as a newborn, in the discharge ticket, you need to see is this written there. Okay, and another important thing you need to see written here is the penile length. Why it is important? We talk about the weight, we talk about the head circumference, penile length. With the role comes at the time of puberty. Why I should worried about this point of time? So nobody bother about this particular thing. But any child whose penile length is less than 2.5 centimeter at the time of birth, that means there is a possibility this child is having a multiple pituitary hormone deficiency. So that is the one of the indicator for the MPHD. So penile length at the time of birth plays a very important role. Otherwise you can diagnose MPHD, but when you are going to diagnose, you are going to diagnose MPHD after the age of 3 year, 4 year, or maybe when the hypothyroid features will appear. But the most important thing when we will say about the MPHD, pituitary कौन से हार्मोन secrete करती है? Just go back to your NEET classes. So growth hormone, thyroxine, prolactin, okay, और ACTH. So एक और gonadal. So the most important, why I am talking about the ACTH particular point of thing. If the child is not secreting ACTH in a proper way, then what will happen? That is an stress response. So a child who develops simple loose motion vomiting, if that child is a case of MPHD, he will come to you in shock because there is no protective phenomena, there is no, and they usually die. Most of the children with cortisol deficiency or adrenal insufficiency usually die undiagnosed because they present with a similar clinical feature just like sepsis. So they will present just like sepsis, and the people treat sepsis, they forget about thinking about the MPHD or there is a cortisol deficiency. So it's very important to see this penile length at the time of birth. Then 6 weeks to 3 years, there is a vaccination schedule, 6 weeks, 10 weeks, 14 weeks, 9 months, 18 months. So whenever a child is coming for the vaccines, at that time you need to take the weight, length and head circumference. And 3 to 6 years, because the growth is not that rapid, what you can do at this point of time, every 6 monthly you should take weight, height and the BMI, because now obesity is the another paradigm that started in, we are seeing in the children, and that is the onset usually at this particular age, especially in the post COVID era. We are seeing lot of children with the obesity in this particular age group, and because there is a mobile in hand, they are going to the school, so they are not having sufficient time for the physical activity, and this is the reason they usually gain the weight. And 6 to 18 years, you need to check the growth annually with weight, height, BMI and pubertal staging. So what I suggest in most of the time, whenever doctors usually ask adolescent girl or adolescent boy, they don't want to come to the parents to for the, if you ask them to go ahead for the pubertal staging, the best way is you can just hand over the pictorial chart to them. and just ask them to pick it up or tick it up on a particular point, that what is the stage of pubertal stage you are at this point of time. And most of the children are very happy to revert you back on the when they come in the next visit. They will come back with the chart that this is my pubertal stage. So that is always easy to do it. Now wait. The one important thing in exams, sometimes this happen, whenever we ask jao weight leke aao, and the student usually go, they don't take out the clothes. And in pediatric population, especially in this age group, if you are having the exams in December, that usually you have the final year exams, and child is having lot of winter clothes with on them, and your weight is 300 to 400 grams, and maybe you are going to miss the severe acute malnutrition, then you are trapped. Okay, so it's very important. So in a smaller children, you can do this slide beam scale or electronic scale. Nowadays the electronic scale is available everywhere, so it's very important. Other mistake that usually the student commit, they don't make it zero. So the last student taken the weight, it was somewhere 100 to 200 grams, there was already there. They didn't, with the because of the stress, they again put their child on the this particular scale. So they usually miss that zero, and that 100 200 gram usually changes the accurate weight recording. Okay, so what is the how the weight? So at the time of birth, the normal expected weight is 2.5 to 3.5 kg. The average mean weight we usually say is the 2.8 kg. So याद रखने के लिए I usually remember as a 3 kg. Okay, because now the nutrition is so 3 kg in a term. Otherwise, normally born term child, no issues with the mother side. So probably the child is born as a normal birth weight is a 3 kg. So this weight usually doubles by the age of 5 months. Okay, and then triples by the age of 1 year. So this is the simplest formula. So at the age of, you just ask the birth weight and multiplied it by 3. That means most probably this child, you should, ideal weight should be this. If the child is not having that weight, there is something gone wrong in between. So that is the expected weight what I am talking about. At 2 years the weight is almost 4 times. At 3 years the weight is 5 times. 5 years it is 6 times. 7 years it is 7 times. 10 years it is 10 times. So this is the rough formula. You can plot it on the growth chart and decide what is the exact weight. But if you are not having the growth chart available with you, then you can just remember this particular table, that what are the times I need to think. So 10-year child, I am expecting that his weight should be 30 kg, round about. 7 years old child, I am expecting 21 kg. 6-year-old child, 5-year-old child, I am expecting 18 kg. So this is the normal way I can start thinking. Linear growth assessment. So you need to take the height. What is the difference between height and length? Which is more? Is there a difference between height and length? Length will be more. So length is usually 2 centimeter more than the height. So especially in the pediatric population, less than children who are less than 2 years, you need to take the length, because they may not able to stand in a proper way. May not be the milestone is achieved, or there may be a possibility the child is not ready on to follow your instructions. Okay, because 2 year is an age when probably they will not listen to you. So first 2 years you need to take the length, and any height below 90 centimeter, or if height is 90 centimeter, even it is preferable to take the length in any child. Older children, you should take the height. This I already talked about. In a smaller children, whenever you are taking the height, what is the instrument called, equipment called? Infantometer. Okay, so this is called infantometer, and what we are doing in adults, in older children, is called stadiometer. So there is a stadiometer, and this is an infantometer. So this is an infantometer. You need 2% to take the length in a younger child, especially in a less than 2 years old child, because you need to fix the child's head at one side. At the one side you need to fix the foot and also the buttocks. Okay, so this is the way they usually take the, so this buttock should be in a 90-degree angle and the head should be straight, and then you need to take the height. So infantometer, you need 2 observers, supine, eyes straight. It's very, this is called a stadiometer, that you can prepare at home also. Head. So the important point is, whenever you are seeing this height measurement, there are 4 points that should touch to the wall or touch to the stadiometer: the occiput, the shoulder, the buttocks, and the heel. So these 4 points should be touched to the stadiometer or to the wall whenever you are taking the height. Second thing is, you need to press this on the skull. Nowadays there is a different types of hairstyle. So if you take it a little, automatically 2 centimeter height will grow up. Okay, 2 to 3 centimeters. So you need to be very careful whenever you're taking this point, and definitely they should be without any shoes or sandals. So that is another important thing. So you need to take the height measurement. Then there is an upper segment lower segment ratio. You've seen many of the time in the movies and other places, the children with hypochondroplasia or skeletal dysplasia, you usually see. Okay, so in those children it is usually required to see for the upper segment lower segment ratio. Upper segment is actually the sitting height of the child. If you ask the child to sit and you take the height from the pubic symphysis to the coccyx to the head, then probably this is the sitting height of the child. At the time of birth, usually the upper segment is more than the lower segment. So the ratio is usually 1.7 at the time of birth. This ratio become equal by the age of 10 years. Okay, and then this ratio in adults usually come down. So ours lower segment is little on a higher side and upper segment is on a lower side. That is the adult ratio. So zero point 0.9. What you will see, what it indicate to take this upper segment lower segment ratio. Obviously, upper segment lower segment ratio you can see in the rickets, because rickets is the disease of the growing bone. We usually say disease of the growing bone. So growing bone, whenever child start talking, so that usually damage the uh, cartilages and result in achondroplasia and congenital hypothyroidism. So these are the children, they usually have the upper segment lower segment ratio at the infantile ratio. And in conditions epiphyseal dysplasia, there is a decrease upper segment lower segment ratio. So it is the importance of taking the upper segment lower segment ratio, and then you can decide that where you are going. Other important thing is the arm span. Sometimes if you are not having all the facilities available, you can just simply ask to stretch the arms and take from this finger to this finger the measure. Usually this arm span is less than the height till the age of 12 years. After the age of 12 years, it becomes equal. So this is my height. I can say, what is your height? This is my height. So you can just calculate in that way. But this is an indicator. If the arm span is more, then this is an indicator towards the Klinefelter syndrome and Marfan's. So there is a Marfanite feature. A child is very tall. If you see the hands are going more than looking much bigger to him, and there is a lot of flexibility in the joints. If you ask him to keep this, you may ask him to make the fist. Your thumb will not cross your fist. It will remain inside. Okay, but in Marfan's, usually this will cross. This will become bigger in a normal way. If you try it out and if you are having some flexibility, probably you will do it, and don't start thinking that you are Marfan's. But definitely there is an, so in a normal way. So this is the indicator that there is an, you are dealing with a Klinefelter syndrome or Marfan's. Head circumference is the another important thing. Whatever you are here, I am again and again saying, it's just because you are first 5 years primarily. The important thing, you should use the non-stretchable tape. That is the important thing. Then you need to take the two important parameters. Most prominent height. This picture is wrong, though this is a very picture when I used to study the pediatrics, MBBS. Till that time, this is not the most prominent part of the occiput. You think so? In this picture, the most prominent parts should come somewhere here. But this picture, when they took this picture, probably this is on a lower side. Okay, so the most prominent part is the occiput. So you need to keep the at occiput, and on the front side to above the supraorbital ridges. So above the supraorbital ridges, you need to just keep it. यहाँ भी इन्होंने थोड़ा सा ऊपर लिया हुआ है. It should be just to the supraorbital ridges, and it should be a cross method. You should not just try to touch it. It should always be a cross method, and you need to take it. These are things very important, usually taught in the clinics, but in the exam these are very important. We just ask, because you are taking the exam of 30 students in a single day, probably it is very and 4 days or 5 days nowadays. So fifth day that you can understand the examiner's mentality. So if you are reached to the last day of exam page, then probably it is very difficult. They usually ask 2 or 3 questions. If you are knowing these basic things, then probably you go ahead. Okay, so these are the very important thing. What it indicate? It indicate usually if a large head is there, it is an indicator for the maybe in the early age rickets, but the most commonly we will associate with the hydrocephalus. Okay, आपके पास वाले को भी जगा दो, इसको बोलो यहीं रहे. Are you here in the class? Just sitting. So hydrocephalus, or there is an exhale that can be there. But this head size can only increase in the earlier phase because there is an open anterior fontanelle, posterior fontanelle and sutures. So this is the reason there is an increase in size. Exhale happening in age like me or any age after the fusion of sutures or closure of fontanelle, then the head size will not increase. Okay, a small head size is very important in children with the cerebral palsy, microcephaly, congenital infection. So if a child's head circumference is not good, that means you are dealing with some particular condition. So what is the head circumference at the time of birth is 35 kg, 35 centimeters, sorry, 35 centimeters. Then by the age of 2 years, it reaches to the 47 to 48 centimeters. So the maximum growth usually happens in first 2 years, and after that it usually reaches to 50 to 51 centimeters. This is the adult head size. Okay, so this is very important. Then there is a chest circumference. At the time of birth, chest circumference is usually more than the head circumference. Okay, sorry, chest circumference usually less than the head circumference. So usually when a child is born, your head size is more, your chest size is less. As you grow, your chest will become more and your head size will remain at a particular point of time, because you are knowing in the previous slide. So 1 year usually this chest circumference and head circumference become equal. After the age of 1 year, usually this chest circumference is usually the more. Mid upper arm circumference, I will not talk much, but acromion process, olecranon process, you need to take out a midpoint, and at that midpoint with a cross tape method you need to take out. When we will say severe acute malnutrition, by definition what is the cutoff? यार क्लिनिकल पोस्टिंग हो चुकी है ना? हाँ? I'm talking about, I'm not talking statistically, na? I'm talking simple measure terms. Any child whose head mid upper arm circumference is less than 11.5 centimeter is a child with severe acute malnutrition. Okay, less than 11.5 is the cutoff. Okay, uh, so these are the normal. Usually people don't ask, but you should know when we will say SEM, when we will say MEM. Okay, these are the few things. Sharkey's tape and Bengal test, these are the previous tests. Uh, but if an examiner come very old age, then probably he will ask what is Bengal test. So there is a 4 centimeter internal diameter. If you ask the child to take, then that Bengal will, if it is easily going, that means the child is having a severe acute malnutrition. That previously people used to do it. Then understanding the growth charts. So growth, I told that this is very basic, but basic always create problem if you don't know the basics. So this is the basic, you know. Next thing is you need to plot on the growth charts. There are various growth charts. So there is no ideal growth chart for any specific population, because a person belonging to North India from Haryana, probably they are having the height from the birth on a higher side. A child who is born in the northeast, probably their height is on a lower side. So you can't compare even the same height chart, same growth chart for our population only. So it's very difficult. So there is no ideal chart, but there are definitely some chart that is the reference charts. Okay, they are not the standard charts, they are the reference charts. So you can say that probably I am dealing in the within a particular range. So these are the growth chart, but on growth chart, plotting these parameters, there are multiple lines, and plotting these parameters, weight, height, BMI, waist circumference, upper head, probably it is going to be really require a lot of time, and maybe it will not give in 70% of the children will not give any added advantage. So most of the doctors that usually don't practice in their regular practice, so it's actually give the picture just like this, you know, if someone sent to me. So the most important is which chart you need to select, how to plot it, and how to interpret it. So in next 10 minutes or last 7 to 8 minutes we will just discuss with this. So there are a lot of parameters. So what should be the ideal characteristic of a growth chart? It should be simple, so nobody should get puzzled. It can be used in the OPD. It should be inexpensive and easy to use. So these are the few characteristics that what you want in any growth chart. So these are the guidelines given by the Indian Academy of Pediatrics, published in 2017, that you can use the WHO growth charts in 0 to 5 years. Hopefully in next year Indian Academy of Pediatrics is going to publish their charts for the 0 to 5 years also. But at this point of time, the recommendation is that you need to use the WHO growth charts in first 5 years. After the age of 5 years, that means 5 completed years. 5 years, 5 is year also and 5 is year also. If it is a 4.5 years, where you are going to plot? So WHO. Okay. So 5 to 18 years, you need to use the IAP 2015 growth charts. Okay, now they also revise. So this was the guideline given. So blue for the boys and pink for the girls. That is another important thing that you need to remember. All of us remember, but for growth chart you need to remember. So whenever you will get a chart, sometimes when you take out the photocopy, probably it is very difficult to differentiate what is blue and what is green. We have pink. So these are the WHO charts. So WHO chart, there is an head circumference, this is weight, there is a hand circumference, there is a length. So this, and on the back of the chart you will get the length for weight in centimeters. So there are both sides, they are printed. At one side there are 3 parameters and the other side there is an other parameter. This is for the girls, this is for the boys, 5 to 18 years boys, this is for the again for the girls with the similar. Here they are having, because after the age of 5 years probably there is not much role of taking the, why there are 3 parameters. 0 to 5 years में 3 पैरामीटर थे ना, क्योंकि हेड सरकमफ्रेंस की वहाँ वैल्यू थी. 5 years पे हम ये मान के चलते हैं कि उसका हेड सरकमफ्रेंस ऑलमोस्ट एडल्ट साइड पहुंच चुका है. So probably it is really not required to plot head circumference further on. So after 5 to 10 years there are only 2 things that you need to plot. This is for the weight, this is for the height. Okay, and on the back you are seeing the BMI. Okay, the similar weight for height, but so these are the combined charts. So what IAP did, because pediatrician usually get away from the growth chart, so they did just combine the WHO growth charts and IAP growth chart and given a combined WHO and IAP growth charts also that can be used for 0 to 18 years. But as an undergraduate, for exam point of view, for Viva point of view, or for as a take home message point of view, till 0 to 5 years is WHO, 5 to 18 years it is IAP. Okay, so there are all 2 axes. On x-axis we usually keep the age in months or years, except weight for height charts. Weight for height chart there is a on the back side, and y-axis we use for different thing for different chart. So this is age in months in 0 to 5 years, and after the age of 5 to 18 years we are using the age year on the x-axis. Okay, and then y-axis I already told you there are 3 things: weight, head circumference and length. Here this is the weight and height. The same for the, and on the back of the chart you are using a length and weight. So you are having a length here and weight here. Okay, so this is y-axis. How to plot? So you need to take a single page where you can plot all these parameters. On the back side, weight for height, you can do it. 4 percentile is more important, otherwise they are given 7 percentile, but it is preferable to use 4 percentile. They are expressed both percentile and z-score. Vertically, one dark line is equal to 15 days and one light line is equal to 1 week. And horizontally, one line represents 1 centimeter or 1 kg. So whenever you will see the growth charts, you can just see and go through with all these, that what I am talking about. Then enter the name, date of birth on the chart. So date of birth is another important thing. 5 में लगा है और 5 का हो गया है, दो डिफरेंट सेंटेंस है. कितने साल का है? 5 साल का है. But there is a possibility she is saying 5 में he started running in the 5, that maybe he just completed 5, and that will change your parameters, so your centiles. So it's very important to put the date of birth. Then growth is marked with a dot, not a circle or cross on, and then you need to plot it out, and subsequent measures उसके आगे के आप ले सकते हो, and you can see the growth velocity in your subsequent follow up. In the next class we will talk about this importance, that how can it is going to work. So it should be a circle just like this circle, not this type of circle or not this type of circle, cross. So it should be there. These are the 7:3 curves. So is there any role of mid-parental height? Last 2 slides, 2 to 3 slides. So mid-parental height, yes, length is primarily dependent on the mid-parental height. Okay, we usually say the mother is short, तो माँ की फैमिली की तरफ गया, नानी बहुत छोटी थी, भाई इसके घर में कोई बुआ बहुत छोटी थी, and that usually parents अपने ऊपर नहीं लेते, या तो बुआ पे लेते हैं या मामा पे लेते हैं, है ना. So the opposite side usually go to the opposite side. So that usual trend. So it's very important to take out the mother and the parental height and take out the target height for that particular child. So how to take out the target height? You already had a clinics. How to take out the target height? Average. So you need to calculate the mother's height and the father's height in an ideal way. Don't listen to them कि शादी के टाइम पे 4'2" थी ये, है ना, and now my height is 5'10". It's not required. You need to take yourself that the height is correct, because you are labeling a child some to that particular child. So most of the time parents usually come with a ready-made answer. आपकी हाइट कितनी है, आपकी वाइफ की कितनी है. वाइफ की हाइट एक ही बार पूछी जाती है लाइफ में, है ना, शादी के टाइम पे. Nobody asks after that. So it's very important to take out the mid, calculate both the heights and you divide it by 2. Okay, so once you divide it by 2, if you are calculating the mid parental height or target height for the child, then you need to add 13, because this is the, with literature, this is an accepted norm that usual difference between the boy and a girl's height is 13 centimeter. So that is the expected. So that is by literature, by various papers. So this is the consensus that in a child, in a boy and girls, usually the height difference genetically is 13 centimeter. So this genetically you need to add. So if you are taking out a divided by 2, if you are taking for the boy, then you need to add the plus 13 in the both the height, and if you are taking for a girl, minus 13, and then divided by 2. Okay, so this height can be plotted at 18 years of age. यहाँ जब आप ग्रोथ चार्ट में प्लॉट करते हैं तो वहाँ 18 years पे, आपने पिछली स्लाइड में देखा था, ये 18 years का पॉइंट है ना. यहाँ पे हमने इसको जाके एक टारगेट हाइट लेबल कर दिया. ठीक है. So once we label this target height, then you need to take out the target height range. If you start thinking about target height, then many of you will go in depression, that why my height is not that much. So there is always a target height range. So that range is usually plus minus 6 centimeter. So if I suppose my height is slides. Okay. So if I'm taking my height is a 158 centimeter as an average height, then plus 6 centimeter and minus 6 centimeter. So I am expecting that my child will go somewhere in between. Okay, so he will either go 164 till 164, or he or she remain till 152. So the target height range is from 152 to 164. So in where, if the child is fitting anywhere following that particular line, I am okay with that. If the child is not following that mid parental height, definitely there is an issue. Okay, sorry, just very fast. Other parameters that we usually take is the waist circumference, upper segment, lower segment. We already talked about growth velocity, stretch penile length, wrist circumference. Nowadays people are using for the obesity. Okay, testicular volume in an adolescent guy is very important to take the SMR and do the. So West syndrome nowadays, because our country is actually, we are meant to be obese. Genetically we are obese. So, and we are seeing there are many obese patients that don't have any metabolic syndrome, because the metabolic syndrome is primarily dependent on the waist circumference. So if your waist circumference is more, you are having a high chance of developing the metabolic syndrome. Okay, so now there is a lot of research on this particular point. Weight से कुछ नहीं होता dear, पेट से होता है. So they usually say it. Okay, growth velocity, if your child is not growing up as per the 50th centile, that means here something is wrong. Anything that is less than 25th centile, this is the growth velocity chart available. So these charts are available freely on online. You don't need to purchase, but you need to just plot it out. Upper segment, lower segment ratio charts are also available. SPL charts are also available. Testicular volume charts are also available. Even there is an IAP application is available. Now this is a time of AI, so nobody wants to do, so just put it here and automatically the growth charts will appear, and this can be used. Give to the parents, ask them to download, they will just put it and they themselves can start following it up. So this is just an example. 12-year-old girl, height is 132 centimeter, weight is 28 kg, father's height is 164, mother's height is 151. बताओ, मिड पेरेंटल हाइट निकालना है, इसमें टारगेट हाइट निकालना है, कितनी हुई? मैंने बताया था कुछ रफली 162 और 152, तो मैंने वैसे ही बोला था उसी के आसपास होगा. ठीक है. सो डिवाइडेड बाय 2, 151 प्लस 164 डिवाइडेड बाय 2. अब इसमें हम क्या करेंगे? हमारा इसमें या तो हमने फार्मूला देखा था, हमको बिकॉज दिस इज ए गर्ल चाइल्ड, सो आई नीड टू सब्सट्रैक्ट 13 फ्रॉम दैट. Okay, 151 plus 164 minus 13 divided by 2, it will come roughly 151 centimeter, and then the range is 145 to 157 centimeter. So by adding the plus minus 6 centimeter, so this is the, so this child is falling somewhere less than third centile. But if you follow this particular line, the mid parental height you are seeing, the lower line is the mother's line, that what you are expecting. So this is the mid parental height, so this is the lower line. So this child is following the mother path. So there is a possibility this child may not be having a proper, this child is short stature, there is no doubt, because this child is less than third centile. But is it really needed to investigate? That we will decide in the next class. Okay, so this is the child. At this point of time, I can say हमारे मम्मी पापा छोटे हैं इसलिए आप भी छोटे हो, इसलिए आपको ऐसे ही कंटिन्यू करना पड़ेगा. at this point of time. But is it really needed to work it up? That we will see in the next class. So learning points is anthropometry is must in each OPD visit, growth chart is inexpensive, which chart we need to use, MPH how do you need to calculate. Any questions? I think I finished at right time. No? Thank you.